Assalamu alaikum, uncles and cousins. Ashraf here. My message was going to be long, so apologies for sending this on a voicemail. There's no question that in KwaZulu Natal, we're now in the beginnings of a massive upsurge in cases that are affecting every sector of the community, including those that are very, very close to us. Our hospitals have suddenly, unexpectedly, and we're expecting a gradual escalation, are now suddenly full. We have no ICU beds in most hospitals in Pietermaritzburg, and so too in Durban. Patients are coming in relatively stable. Sometimes you think you're going to get away. They come into the wards. They don't even need oxygen, and suddenly, in a matter of minutes, they deteriorate, are rushed to ICU, and ventilate and are being ventilated. Although we know ventilation is a death sentence, but because at that stage you can do nothing, you're putting them on a ventilator and leaving it to Allah Subhanahu wa Taala. Our best treatment for this is absolute prevention. There must be nobody that must be allowed to visit your house, neither should you visit anybody. You stay locked indoors. You need anything, you allow them to come and deliver to your front door. You bring it, you don't touch the items for 24 hours, you spray it, and then you can pack it and you can be safe. Do not allow any visitors to come into your home, and please, even when we're reading namaz in congregation in our complexes, please try and maintain the distance there, because we don't know who's going out and who's not going out, and one person can spread the entire village. And this type of death is a very cruel death, I must tell you. We all are prepared for our death, and if Allah needs to take us, alhamdulillah, we will accept as we need to in our religion. But it is cruel, the way we die without seeing our family, without our loved ones, in a coma, heavily sedated with morphine, not reading our kalima. And basically, doctors sometimes have to give us morphine when they know the case is hopeless to create a bed. Many patients stay in hospital ICU for more than 10 days and they don't recover. And then the ethics of the situation is we gradually withdraw treatment, even though Islamically we're not allowed to do so, but we know the case is hopeless and we have to make a decision. It is not possible for anybody to get this virus if they stay at home, are not in contact with anybody, and those members of the family that are living in the home are not leaving the home either. It's almost like a prison sentence, but this is it. Prevention is your best cure. I need not mention, but already our family members are getting afflicted. Many of our youngsters will get better and they will improve, but they will come into contact with their parents who are older or their grandparents, and that is the danger. I've taken my son out of school. He went to school for one day and he's out, simply because I can see what's happening in schools already. He'd rather learn at home on his distance teaching than to come around here and infect us. And then, kids are kids. They're going to run around and meet other people in the village and mix. We can't control children. So please, we are going to be placed in a situation. Some of us are going to need ventilation, and we're not going to have any ventilators. I have bought an oxygen concentrator and I've ordered a couple from a supplier. It's only going to come in 2 weeks, but I got one oxygen concentrator in case anybody, but it's not going to help. We need to give 30 to 60 liters a minute of oxygen to avoid ventilation. Our machines at home can only go up to about 15 liters per minute. So please, this is a time. I just feel that now the time has come. When the epidemic started around March 5th, we all went on lockdown. We never knew whether Natal would be the first to last. So our initial lockdown was simply because we never knew. But obviously we could have worked till in April, we could have worked in May, and maybe around June we could have started taking preparation. But of course, only Allah knows when the epidemic comes. But really, Natal, it's come with such a speed and ferocity. It's unbelievable. Midlands Medical Center had 2 or 3 patients a week ago. It's now got 40. And our staff are now going to get sick. Doctors are now, we have got a rotation system whereby if the doctors get sick, there'll be second line doctors. We don't want all doctors to be exposed to 1 or 2 patients each. Rather, one doctor treating 10 or 12 patients. And that too, a doctor doesn't come by your bedside anymore. We're not even allowing that. We're doing our instructions via remote control, seeing your face via iPad and giving instructions to adjust ventilators via that. So even we have to now protect ourselves, because 14% of doctors are dying as opposed to 2.5% of the population. The death rate is 6 times doctors. So please let us not put ourselves in a position to risk ourselves. and to others. And most of our elder family members, are after the age of 65, and most of them are diabetic, hypertensive. If 5 bypasses, a couple of valve replacements, even the youngsters must be a bit careful uh, in terms of how they handle themselves. Let's just lock ourselves up till the end of September. It's a long time to sit at home, yes, but we have to do that at least till the end of September. Inshallah, maybe earlier. Let's wait and pull time for the vaccine. Vaccine will save us all. Until then, we don't want to get this horrible sickness and then have a regret as to why we never take it seriously. Many people haven't taken it seriously. Most of them are gone, and some of them are sitting in the hospital. I thought it was a joke, but please be careful. Assalamu alaikum. If I offended anybody, my apologies.
Under isolation, and just be a little bit more careful. What I'm trying to say is, ideally, you should stay in your room for 14 days and even avoid coming out of your room if you can. Hopefully, you have an ensuite, and most things can be done. And then after 14 days, you can come out of your isolation. After 14 days, you can come out of, you can say you can de-isolate yourself if you do not have any symptoms. If you do have symptoms, then now the most dangerous symptom is shortness of breath, difficulty in breathing, and we've noticed that between day 7 and day 11 are the most dangerous times. Give you an example: if you have been infected, you've got symptoms coming on a Monday, but by next week Monday, the following Monday, right up to Friday, are your 4 days in which you can take a turn and will need you to come into hospital, because the only reason to hospitalize you is if you need oxygen, you need closer monitoring, and you need a special type of oxygen treatment, which is called high flow nasal oxygen, which I'll talk about later. Next slide. So close contact, it means that there's 3 Ds as far as contact is concerned. One is the distance, the dose, and the dispersion. Now, the distance means that if you are less than a meter from a person, and if you are talking to this person for more than 15 minutes, and that is the golden hour. I mean, if you are casually passing somebody in the passage of your company, and you'll just brush each other, and your meeting is probably a couple of seconds as you cross each other, you are not in danger. There's definitely no danger. So the distance is the first thing. There's 3 Ds we say. This distance, number one, to be safe, 1.5 meters. To be absolutely safe, 2 meters. So perhaps take a bit of a wide arc when you are passing each other in the passage. Or if you're sitting in a meeting room, make sure there's a 1.5 to 2 meter gap. The meeting should not be more than 15 minutes. If somebody is suspected there, try and keep your meetings as short as possible. And if you don't have meetings, then we have other measures to have meetings. The risk is very high when both people are not wearing a mask. And again, in one of the slides, I'll show you the dramatic reduction in the risk when both people are wearing a mask, or all people should be wearing a mask. The last D, the first D I mentioned was the dose. The second dose duration. The second one was the dose distance, and now dispersion. Dispersion is the fact that if you are sitting in a closed room, for example, you are sitting in a taxi or a bus, public transport, and things are concentrated, then the risk of the virus floating around for longer than it should is much higher. Whereas if you are sitting in a room, the sliding doors are open, your windows are open, even your air conditioner is started. And remember, we're using not the recyclable air conditioner, but the one that works on a one cycle, which extracts air one direction rather than recycles air. So you just got to check your air conditioning system. But if your air conditioner is off, you open all your windows and you make sure there's proper ventilation in your room. So this is absolutely critical in terms of that. And if I were to say, what is the most important thing you can do in this virus, I think this is the slide that that we should digest and not inhale. But this is a slide that we need to remember the most, because amongst all the other things, the washing hands as often as possible, the wearing of the mask, and social distancing, this is, I think, the most important, and the literature agrees with me that it is the lack of social distancing that is responsible for what we are seeing now in KwaZulu-Natal and what has happened in the very high risk areas of the world, like the United States of America, and also in Russia, in Iran, and Brazil is an absolute disaster. It was like what can I say, samba time continuously, and unfortunately there is a massive epidemic there at the moment. Vast amount of numbers reaching 1 million and high death rates around the 20, going to be more than the 5% mark that America is sitting at the moment. Next slide, please. Yeah, so of course there is what we call the risk stratification. I noticed that I'm seeing teachers and I'm seeing people that are working for the state in numerous jobs coming to me for letters. And we have to be fair. If we as doctors tell you that if you're older than 65 years or older looking 60 years, you are overweight with the body mass index of more than 30, physically you may not be very fit, but the most important risk factors are diabetes, number one. 47% of the deaths have been described in diabetics. 47%. Let's just make it 50%. Now, not diabetes, ordinary diabetes. If your sugar is well controlled, your hemoglobin A1C is 7% and less than 7.5% if you're 65 years old and older, you are a well-controlled diabetic. Then your risk there's no risk. Yeah, that risk factor can go away. Having said that, sadly, only 50% of diabetics are well-controlled diabetics. But if you need to go home with a figure, then the gold standard test is called the hemoglobin A1C, HbA1c. A figure between 4 to 6 means you are normal, you are not diabetic. And if it's more than 6, you are diabetic. Any figure less than 7 means you're a well-controlled diabetic. But for 65, we can go up to 7.5. If you have any kidney disease, if you had a heart attack and you're on cardiac failure treatment, or you're a smoker and you've got chronic lung disease, or if you're a poorly controlled asthmatic, then that also obviously increases your risk because these things depress your immune system. And obviously, if you've got any other sickness, you've got TB, HIV disease, and cancer, and even chemotherapy, then simply because these illnesses depress your immune system, and sometimes when you take the treatment for these diseases, they also suppress your immune system. Having said that, in South Africa, we have found, even though the HIV patients are a bit more risk of getting the COVID infection, we have thankfully found they respond quite well to all the treatments that we are commencing them on, and there has been no increase in the mortality. So yes, infection rate is higher in the HIV patient, but we have found, thankfully so, the mortality rate is similar to the rest of the population group. Next slide. Yes. So I'm not going to spend a lot of time on your slide, but obviously, how do you know if your BP is controlled? So right next to my bed here, I have my portable. Can you see this on the screen? Hello,
We
can
can
you
see it. We can see. Thank you.
So this is my machine here, and I check my blood pressure. I'm doing it a bit more often now, and I take my medication every day. And secondly, I bought this device here. It costs about 650 rand. It's called a pulse oximeter, and also as far as the pulse oximeter goes, I will talk to you all about that a little bit later. But it's in your screen at the right bottom picture. So how do we know that we are getting a problem when we're monitoring ourselves at home? We insert this pulse oximeter. I hope you can see it. So we put it into my finger, nail up, and then I press this little button here, and then I will get a reading to give me my oxygen levels. Like for example, you'll see my oxygen levels are 98%. Thank God for that. And my heart rate is 88, which is normal for me because I take some asthma medication and that causes my heart rate to be higher. Most of your people's heart rate will be between 60 to 80. A fast heart rate means over 100. So that's just to remind you. This is a very useful test, which I'm going to talk about a little bit later, that will help us to decide when you're going to get to hospital. So simple device at home that will tell us when you're running into trouble, especially if it comes to the lungs. Okay, we can move to the next slide. So remember, your oxygen saturation should always be more than 92%. Can you all see me, gentlemen?
Doctor, we can't see you. We can see the slides because I think the slides are playing. But I think go ahead and we'll see you just now. But the slides are coming up quite nicely and your voice, we can hear you. Thank you.
Okay, we can go to the next slide. Right. So in terms of the treatment of this disease, this is a very useful slide, and this is something that one should make a list of and remember. So remember, we do not have a cure for this virus. We do not have a magic panacea to say, well, don't worry, if you get the COVID, you come in, I got a medication for you, you're going to walk out from here and you're going to be very well. The entire course of COVID is entirely dependent on your body's ability to fight off this virus using remedies and immunostimulating agents, natural, most of them, alhamdulillah, that will assist your immune system. And these things work, they really work, and I'll tell you this now. So if you've got pain and you get fever, please stick to Panado. Don't ever use Voltaren and Brufen and Atrexin and Celebrex and Vioxx and Acoxia. Don't use anti-inflammatory drugs, because these anti-inflammatory drugs are, as they say, anti-inflammatory. They affect the body's inflammatory response, and they will obviously affect the ability for you to mount an inflammatory response to fight the infection. So warm water and honey, extremely good. Warm water and honey, warm water with honey and lemon. So what I've got recently that I've picked up in our medical literature, and our medical literature is now almost like we're reading a naturopath type of articles, is to so you'll have read about taking honey and putting a few slices in hot water, and then you put in a little bit of ginger in it. You put a teaspoon of cinnamon, and you wait for the water to cool down a bit, and you have half a glass twice a day. This is extremely good. Lemon is a panacea. It's amazing. It won't cause your sugar to go high. In fact, it will control your blood pressure, help clean your vessels, and boost your immune system. So maybe even after the epidemic, we'll have this type of habit sitting with us. So once the COVID is over, it doesn't mean the normal annual flu will be over. It'll still help us with the annual flu as well. The water and the salt gargles are, I think, quite important, because the entry level of this virus is through your nose and through your mouth. So if you have any doubt, you come home and you gargle your mouth with hot water, the warmest water you can take, to kill the virus that may be sitting at the back of your throat. The virus breaks down quite quickly with warm water, and salt you can use as well. And somewhere along the line, I did read that if you put a drop of coconut oil in your nose, in each one of your nostrils, especially if you're attending meetings, then the virus is immediately destroyed on contact with the coconut oil. So that's another useful thing to do. Now, while you're sitting at home, while you're sitting at home, you create steam via your your steam bottle, your steam container to make your tea, and you can put a little bit of Vicks around the tips of your nose and cover yourself with a towel, and you try and take deep breaths in and out. This type of respiratory exercises is quite good. And I'm going to show you a slide later of what I tell my patients to do in the hospital. So currently I got a few patients in the hospital, and I've left them my own, what I picked up from the literature, obviously, is what they do while they're sitting in the bed, in terms of the body positions to try and ventilate the lungs and to use what we call utilize the dead space in the lungs to oxygenate themselves. So everything is designed to help your airways to recover. The cause of death is a massive destruction of your airways, which is a mix of an infection causing a massive inflammatory response, breakdown of our active breathing space, exudation of fluid, and no place for gases to exchange, and a catastrophic drop in our oxygen levels, and so on. So other things like black seed, tremendous. You know, black seed, and I learned this recently, is actually the product of hydrochloroquine, which is the drug that we use to treat rheumatoid arthritis, the SLE, and malaria. Millions and millions of people have been cured by hydroxychloroquine, also just known as chloroquine, also known as plasma quine. So you'll know President Trump said that we must use hydrochloroquine for all the patients. But he was talking of a very high therapeutic dose. However, if you take about 10 or 12 seeds of kulunji seed, or if you buy the cumin oil, which is your black seed oil, take half a teaspoon twice a day, or you take the kulunji seed in a teaspoon, add a bit of honey, and have half a teaspoon every day, once a day is sufficient. And if you do have an infection, then they say you should go up to 1 teaspoon twice a day. Then this naturally helps the body's immune system as well. And I mentioned the other natural remedies as well, with ginger, turmeric, and onion. Okay, next, please. Right. Now this is very useful in terms of when you are sitting at home. You can be short of breath at home. It doesn't mean every time the moment you're short of breath at home and you're taking small breaths in and you notice that you're a bit uncomfortable. However, if you use your oximeter, which I've showed you, and you are sitting over 95%, there's no need to panic. But what you need to do is, if your oxygen levels normally run, and most patients' oxygen levels run at 98 and 99, 100%. Now, for you, 95% is low. It's not that you are in the low end of normal. For you, it's low because you know what your oxygen level is. So other than exercising, taking deep breaths in and holding for as long as you can, and deep breath out, deep breath in and deep breath out. I've seen a patient of mine yesterday, because I saw this on one clip. He had his oxygen level was 92%. So I told him to do what I'm telling you to do now. Take a deep breath in and hold. Now, when you hold your breath, you are holding air into your lungs. That you're creating a positive pressure in your lungs, and you're allowing the alveoli, the little air sacs in your lung, to remain open and allows more gaseous exchange. And my God, even the patient was so excited. His oxygen level, just by that exercise of taking a deep breath in and holding it for up to 10 seconds, as much as you can manage, but 10 seconds is, I found, to be a good time. It's not too stressful on the patient. His oxygen level went up from 92 to 98% without oxygen, without me giving him oxygen, just on that basis. So by doing our own little holding the breath, which increases what we call our intra-alveolar pressure. Medical, there's a fancy word called PEEP, expiratory end pressure. You may have heard about it, so I'll just mention it. And that allows greater oxygen exchange, which is ultimately the job of the lung, to change oxygen, to breathe, to take in the oxygen to the bloodstream, and to get rid of the carbon dioxide, which you will exhale. Now, these are the maneuvers that I found are very helpful, and we're doing this. Even patients that are on ventilated, we do this. So for 30 minutes, you must lie on your stomach, and the reason for this is to distribute air to different parts of the lungs. Now, air also got a weight to it. So normally when you're sitting upright, the air is going to the lower parts of the lungs. And then when you're sitting to your right-hand side, the air will go to a different part of your lungs. And you're lying on your left side, it goes to a different part of your lungs. And if you sit upright in the posture you see. So please try and change your position. Next slide, please. Questions or just a few slides. I don't think we have more than 3 slides left. So it should be done in about 3 or 4 minutes left.
Thank you. Go ahead.
Okay, so we already discussed the breathing exercises. Breathing through pursed lips. I mentioned that to you. Belly breathing, left and right hand side. Blowing up a balloon also helps to increase resistance and helps to expand areas of the lungs that need to be expanded. So these are simple things. Next slide. Now when should you seek medical help? Now remember, our objective is to treat you at home. The hospital is not a first option, and it's an option that must not be used because there's lots of things going on in hospitals, infections, and at the end of the day, risking of medical staff, which are critical. I mean, I know of hospitals throughout the country who are in such a dire straits because such a high absenteeism rate. Some is because patients are basically, nursing staff are scared because they have loved ones and families to look after and seeing what's going on in the hospital. Others maybe are genuinely ill, and some of them are, just going away. So if you become confused for any reason, and you had a fever that settled down, and the fever came back in again, and you find that your diabetes is uncontrolled, and you're breathing more than 25 times a minute, and the little oximeter I demonstrated to you, you find your oxygen levels are coming less than 92%, then you need some form of treatment in terms of oxygen supplementation. So then you must go to your doctor. If you don't have any of these, then you mustn't go to a doctor. The whole reason to come into a hospital actually is mainly oxygen level. So that's the take-home message on this slide. The oxygen is dropping less than 92%, then you come in. The other thing is if you're not eating for 3-4 days and you're feeling very weak and you're getting fatigued. Now this is called respiratory fatigue, and doctors can see, hey, my patient is getting tired, he can't manage. Then we bring you in, and then we give you glucose and fluids and try and build you up. Next slide. Yeah. Last week, South Africa had more cases than the United Kingdom, Italy, and France, and Germany put together, twice the number of those 4 European countries. So this is how many cases we had last week. We're averaging now between 5,000 to 7,000 cases. So this is now we're coming to the end of our talk, Shabir. This slide that you now see is this telling us a number of cases that have been afflicted in the past few days. I think the slide is 2 days old. Now you can see United States is having a resurgence with almost 15 states showing increasing numbers simply because they went on a system whereby they opened everything up and they're not firm with the social distancing. So the machine that you see on the next slide is called a oxygen concentrator. So I bought one for my house, and I made a few people in my village buy one because I think, unfortunately, and I don't want to promote any product. I have no interest in this product, I must tell you now, is because the hospitals are going to get full. At least this will provide us with the means of which we can oxygenate ourselves and monitor ourselves for longer at home. So if you use this pulse oxygen concentrator, it's called an oxygen concentrator. All it does, it takes oxygen from the air, concentrates it, and delivers it to your system. Now you know that the percentage of oxygen in the air is about 20%, 80% is nitrogen, and 20% is oxygen. So this 20% may come up higher, and we can deliver oxygen via either the nasal prongs, which will go in here, or via a face mask, and then we use our pulse oximeter that we put on our finger, and we see 92, 94, 95, 96, and then we are doing well. Next slide, please. Yeah. So the most important thing is to be responsible. The stage has come where, because of the economic situation in the country, one had to open up the economy to allow people to earn a living. So in an ideal country, everybody sits at home, the government will deliver you your food, your medication, whatever else you need. But the fact is, there has to be a balance, and life is not about illness, it's also to earn a living. So everybody must be responsible. The picture that you saw before in the previous slide, a mother and a child, they were wearing a mask made of banana leaves. So that just tells us that this is it. If I can just leave you all now, I think this is the last slide. Now we are in a stage where we now all take personal responsibility. I think these are the two buzzwords: personal responsibility. Now we don't rely on the doctors, we don't rely on nurses, we don't rely on the healthcare system. We must now do 3 things. We must all wear a mask when we leave our homes. We must maintain that social distancing. And we must, when we do come into contact with services, we must wash our hands more often. So now let's see what happens when all of us wear masks. If you look at the bottom picture, if all of us wear masks, whether it is a cloth mask, whether it's a surgical mask, N95 mask, there is no difference. The mask inhibits the projection of the virus carrying saliva and particles into the air. We all wear masks. The chances of transmission is only 1.5%. But if one person doesn't wear a mask, the chances of it. So the person who's a carrier not wearing a mask and that poor innocent soul that's still wearing a mask, the transmission is 70%. And other way around, as you'll see, if you're a carrier and wearing a mask, obviously you're not projecting your virus in your sputum, then you are not going to give the person who's not carrying a mask the risk is 5%. So let's go to that 1.5% risk. And remember that this is if we are less than 2 meters close to each other. The risk of spreading is only 1.5% all wear masks. But if we are 2 meters apart, there is no way this virus can go 2 meters unless you're an Olympic swimmer with very strong lungs. Hello? Can you hear me?
Doc, we can hear you clearly. We've been following you very clearly.
So again, the final thing is this. Unfortunately, our figures tell us there's a disproportionate increase in the patients that are demising of the Muslim faith. And we have to question ourselves as to what we are doing wrong. I can't tell you what we are doing right. But the tragedy is that for the size of our population, I think there's an 11 times more death rate amongst our people. I don't want to make any comments here. I'm just giving medical advice. But there is something we're not doing right. And I think I don't want to get into that discussion. Last night I did have a call from some Islamic groupings saying that I must talk to alims, but my knowledge is too poor. And I think with all the knowledge, the information in the media, if I can come back and say personal responsibility. You must decide whether you want to read a namaz at home or read in a little Jamaat Khana where there are fewer people with spacing, or then go to the mosque. But even if you do go to the mosque, you can sit in one corner and you can take your own musalla and you do wuzu at home and you read your fard salah and then you go home. So you avoid that exposure. Anyway, that's the end of my talk. I had to keep the time. It's not at 9 o'clock. I'm very happy to take questions. And thanks again for the opportunity for Al Baraka and its team for this opportunity to share this information. Thanks very much.
Dr. Jazakallah, and thank you so much for a very insightful presentation. There are a few questions. I am going to take it. There's been at least 8 questions around sending kids to school. So, Doctor, I think let's start off with that one. What is your advice for sending kids to school?
Yes. Can you see me properly? Because I put the questions on here. There's a whole lot of questions that came through about me. Okay, you all can see me clearly. So let's go to the school issue. You see, there's no question at all that our Department of Health and our local school management have done extraordinarily well in preparing the environment at school to a degree whereby the risk has been diminished to a very severe extent. However, it's not a completely, it's not an environment that has proven to be foolproof. And I think this is the point. While I'm full of admiration of all the measures that are done, and I was looking forward to sending my son to school, however, I see what is happening in the Western Cape, the Eastern Cape, the Gauteng. I'm looking at the number of teachers that are COVID positive, looking at the number of students, and then I'm looking at the situation, and every parent needs to look at the situation at home. If you've got young parents that are 35, 40, no diabetes, no hypertension, your child is going to school, I think there's no problem at all. But if there is a risk at home, then I think you must make a decision that it must be personal. So I made a personal decision because I'm an older type of a parent. I'm not that young, but I do have a young child. And I just felt that I need to be a bit careful. And then I also had a bit of fear that I'm going to the hospitals and I may give it to my son and then he may give it to somebody at school. So my decision was a personal one, firstly because of my occupation and secondly because of the age gap between my son and his mom and dad. So I think it's a personal decision. And I think if the parents are very, very anxious about sending their children and there's a good homeschooling program, that makes the decision even easier.
Thank you, Doctor.
I've got some questions on your screen.
Doctor, I'll read them for you. Doctor, I'll read them for you. I've been moderating them so it's easier. Is there any evidence that a person develops immunity after contacting and recovering from the virus?
Come again, the question.
Is there any evidence that a person develops immunity after contacting and recovering from the virus?
Yes, very, very, very good question. In the ordinary course of events, if you have developed an infection and you recover, then you can walk in the middle of West Street or Smith Street or wherever proudly, not being fearful. You can go to the aircraft and start your holiday and start your life. However, there is one big thing we don't know yet. Are we getting enough immunity to prevent us from getting reinfection? So we're not sure yet for me to answer the question, but I can answer with full confidence and tell you, once we develop a test to where we test the antibodies via a fingerprint test, in my mind, if it says strongly positive, that means good, high immunoglobulin levels, which is a word for immunity, and that means I am safe. But if it says weak immunoglobulin levels, you've got immunoglobulins, but it's weak, it's a smaller dose, then there's two choices. One, we have to give you a vaccine when it comes available as a booster, or you will be at risk to get another infection. So it all depends on the degree of antibody response that your body elicits once you recover. So that's an answer to the question, and that answer cannot be answered today. It is when we have a safe test. We don't have a test at the moment. There's a whole lot of Chinese tests coming in which are not accurate to measure antibodies.
Doctor, I have disabled your video to improve the sound quality, but we are able to hear you. The next one that I've got is, if one is chronic asthmatic, do you recommend purchasing a nebulizer for home use in addition to the normal asthmatic medications or any other device?
Yes, asthma is your primary disease. Asthma came first in your life. You do what is necessary to manage your asthma. You manage your asthma is well controlled. Indirectly, you will also manage your risk of getting COVID. If your asthma is uncontrolled, then you're more likely to get COVID. So in a simple, yes, you must use a nebulizer. We do not use a nebulizer in our COVID wards because of the dispersion of the sputum all around to nurses, etc. So we in our routine protocol of treating COVID patients in the hospital, we don't use a nebulizer. What we do use is another device to give you asthma medication, a turbuhaler, simple aerosol, or what we call a spacer. A spacer is a little like a bottle where you spray the medication, the pump in there, the aerosol, and then you inhale it and inhale it out. So we don't use aerosols in our COVID management because of the dispersion, the spreading of the particles.
Doctor, any advice for the upcoming Eid with regards to the rituals for the day, Qurbani, Salah, etc.?
My advice remains the same: personal responsibility. If you are going to cut your, if you can maintain a 2-meter distance, if you're going to wear your masks, and you're not going to sit around a table, 10 of us, 20 of us. In my family's case, we are 200 of us that we have to hire a hall, sitting all next to each other. We've cancelled we haven't cancelled Qurbani we're going to have. Most of it will be done overseas. We've cut a few sheep locally, but most of it will send across the border. But we've cancelled our breakfast, we've cancelled our lunch, and we've cancelled our supper where we invite our extended families and our aunties and our son-in-laws and our our other family members. That comes to almost 450. So already it is cancelled.
Doctor, question, is it possible for an asymptomatic person to spread the virus, noting that there's no symptoms such as coughing?
Yes, absolutely yes. This is the weakness of our system at the moment. So remember, day naught is the day you were exposed. So you're asymptomatic for about 4 days. And alhamdulillah, you can remain asymptomatic for the entire 14-day duration of the infection, where you don't even know you had this virus until one day, inshallah, when the tests come. And I've made a prediction that Emirates Airlines, before we board our flight, they will have by that time a rapid test where they'll do a finger prick test on you and they'll say, hey, strongly positive, you have antibodies, you come onto the flight, you're welcome. Sorry, your antibodies are negative, you are still at risk to get COVID because COVID is not going to disappear overnight. They're going to say, sorry, sir, you have to go for your vaccine and you're not allowed to board our thing. So your answer to that, yes, it is possible for an asymptomatic patient to spread the virus. You know that the World Health Organization made a disastrous statement. I'm sure you all read about that, where some person, one of the members of the WHO a few weeks ago, said that it is not possible for an asymptomatic person to spread the virus. It created a furore worldwide. It made actually a mockery of the WHO, being the premier organization for health in the world. And they retracted that statement. So yes, asymptomatic patient can spread the virus.
In terms of the oxygen concentrator, where can that be purchased for home use?
Yes, so essentially there's a shortage worldwide. I bought mine from FarmMed. I paid 9,500 rand for it, and there's about 3 others in the village that paid for that. I've got it lying in my area. I'm going to test it again later today. But you can, there's a person in Maritzburg, his name is Mahmoud Badat. He's sort of bringing in a container and he's taking orders. And so I think in terms of buying an oxygen concentrator, you go to your pharmacist and you tell him to procure it for you. There's companies like City Medical. There's a company in Beatrice Street called Progress Medical Supplies. FarmMed Pharmaceuticals. We're going to get a stock yesterday. They were due to phone me, but they haven't. And there are some doctors who, in their own individual capacity, are importing oxygen concentrators. Now, remember, the concentrator is very different from a nebulizer. But most of the oxygen concentrators also have a pot to do nebulizations as well. You know, for asthmatics, so it will kill 2 birds with 1 stone.
Doctor, just 2 more questions I'm going to take. I do apologize to the staff. There's a lot more questions coming in, but we do have to open up the branches. What does one have to do after 14 days of isolation, but you still have a dry cough?
Yeah. So if you still have symptoms after 14 days, then you should go and have a COVID test done. If the COVID test is negative, then you go back to work. But if the COVID test is positive, you must extend your isolation by another 7 days. It's not normal, but we have noticed that in some patients with severe COVID, where they really had lung treatment, prolonged lung treatment, prolonged hospitalization and ventilation, that their disease doesn't last the normal 14 days, lasts for 28 days. So that's my answer. You have to go for the COVID test first and extend your isolation period by another week. Repeat the COVID test again. However, as I mentioned, if you have recovered after 14 days and you have no symptoms, you are well, then you don't need to do a COVID test. Then you are cured. The COVID test then will only give us a result that will confuse us, because now the end result is we have an asymptomatic, normal, well patient who has now recovered.
Okay, Doctor, I am going to stop there. Doctor, we will engage with you offline with regards to our ability to share these slides and the presentation. It has been recorded, but we'll seek your permission offline. Shabir, I see you have activated your camera, so I think if you want to just thank Doctor.
Thanks very much. I think we can listen to you for the next hour or so, right? Because it's such a relevant issue. You've given a very practical